Namaste and welcome to this podcast with an amazing practitioner and a medical doctor that we have. I myself, Vaidya Jay, but I'm going to be having a wonderful talk with Dr. Trupti Gokani, and she has just freshly hatched a great book that's right behind her, which is the Stress RX, which is the talk of the hour. Thank you, Dr. Gokani, for joining us. And let's talk about what is the stress and how Western medicine and then the traditional Ayurvedic medicine look at it.
Yeah, thank you for having me. So grateful and thankful to be here. I love you. You're just so enthusiastic and sharing so much wisdom with the world, and so grateful for you. So my real intention and purpose with the book is to bring to awareness the importance of Ayurveda. Ayurveda is such a beautiful science. It's incredibly profound and deep science. And if we can bring this into the back pocket of more individuals, right? So more people can have access to how to use Ayurveda in their Western living. And what we know is that there's a stress epidemic. We know that 75 to 90% of visits to the primary care doctor's office are due to stress-related conditions. That was the National Institute of Mental Health many years ago made that statement. So we've known this. Yet, as a physician, I'm a board certified neurologist. How do we manage stress in the office, especially when you've got about 10 minutes with a patient, right? And it's tricky. And so as I was practicing, and I've been practicing almost 2 decades, I realized there needs to be more of a conversation in a way that we can bring Ayurveda into the Western office and into the world to help people with managing stress. And so happy to dig into that in more detail.
Absolutely. So, starting with this, system of, medicine or the mainstream of practice that we have, where the patient care is such short encounter that you definitely stressed upon. What do you think from a Western neurologist to an Ayurvedic practitioner? What do you see that Ayurveda has as a value to this type of clients or patients that we get?
Oh gosh. The beauty of Ayurveda, there's so many, and you and I love Ayurveda, so we can go on and on about Ayurveda. I'll start with some really basic concepts. First and foremost, because I'll tell you, when I was a first year medical student, that is when I discovered Ayurveda. Even though I'm Indian of origin, I come into it and I'm really coming in from a Western perspective, because I was that Western medical student, moving, going, doing, constantly skipping my meals and drinking coffee and kickboxing. And I didn't know why I was struggling. I was having problems with sleeping. And when I found Ayurveda, I say Ayurveda found me to some degree, I realized the one most important thing it taught me that wasn't happening in the Western medical office, to pause, to reflect on who I am and what I play in the role of these symptoms that were happening. Very different, right? When you go to the doctor's office, we want, give me a medication, an injection, a treatment, and please have this symptom go away. That's how we're doing.
And I continue to do what I'm doing.
Why not?
Right?
Because the medication will take care of it, won't it? Won't the injection take care of this? Won't the surgery take? And that's just kind of what Western medicine, honestly, I trained, 20, 30 years ago. That's how Western medicine has really kind of been brought into our understanding of how to approach patients, is to us as doctors to give you the answer. That's not what it is.
Yeah. So in that way, what I feel, being, Ayurvedic practitioner, Ayurveda starts off with self-awareness and mindfulness of bringing the mind and body together, because we look at them as complete separate things, and body needs are different and the mind's needs are different. But Ayurveda says, no, they're one integral part.
That was probably one of the biggest learnings, this connection with self, and then understanding emotional, physical is not separate. And we are one holistic being where our emotions affect our physical and the physical affects our emotions. It's kind of this interplay, right?
Absolutely. So we feel and then we embody. So experiences is what Ayurveda says. Going into, so let's introduce our audience to what an experience from an Ayurvedic way of looking at an expression of some, nature that becomes our experience. So we should talk about that. We should say what Ayurveda says is the experience, right? So
Yeah.
go ahead and then I'll chime in from an Ayurvedic point of view.
So I'll and hopefully this will answer where you're going, but I'll kind of tie it into the book a little bit, because I believe we're saying similar things as I wrote in the book, is this idea of going into a state, or going into, I call it a stress personality. And what often happens is when we move into a space, that becomes our way of being. So if I'm born as a pitta and I start to move and go and skip my meals, as I was doing as a medical student, and disrespecting Mother Nature, who cared if the sun was down? I was going to stay up till 3 o'clock in the morning and study. Then the wind element, the Vata energy picked up, right? My state shifted and my personality shifted to move into that state. And that was that part of the recognition, is understanding, wait. And so stress to me is that disconnect, right? It's I'm maybe born as a pitta, though I've evolved into this Vata personality, who is talking really fast, moving really fast, going really fast, constipated, gas, bloated, go. And I think, wait, what, isn't that who I am though? Because this is the person that's getting through medical school. This is the person that's passing the exams over here.
Right.
This is the person that's also not harmonious and not sleeping. So to me, stress is that disconnect. And so Ayurveda helps you reflect upon your disconnected where you are and where you need to be. So that's kind of how I look at this. And I'd love to hear your thoughts on that too. But that to me is kind of the crux of this book, is getting into stress is really a disconnection with self. And if we could start to spend some time understanding, number one, where we are now, focusing there, and then exploring how we got there, and then slowly move our way back to here. That is when symptoms
No,
resolve,
you said it
disease
very
reduces.
correctly, Dr. Gokani, because
Thank you.
the state is an experience that is repeated so many times that you identify,
That's it.
right? And this
It's attached to it.
identity, so this identity is what we project as our ego, right? So between the ego and then this state of being, whatever I was doing to get myself into a place of self, projection, where people appreciate, or it's all like, bringing ourselves to present, like this is who I am, becomes my egoistic state.
Yes.
Right? And that egoistic state is what sits in between the mind and then the body. And that is stress, because you constantly have to struggle to maintain that state.
That ego state. Exactly. And so in a similar way, and you don't even know. That's the thing to me, is that awareness and mindfulness you mentioned earlier. You don't even know you're there. You just, you live in an embodiment of that. You become attached to that. And all you do is you're just maintaining it, because in that world, that is the survival of being, is to be in that state. And if you step out of the state, there's fear of what will happen to me.
Exactly. Insecurity comes in when you alter that state.
Yes.
The insecurity, as you perfectly said, it's fear. And that fear is the cause for so many diseases in Ayurveda.
Absolutely. And so I think the beauty is, if we can continue to explore this and help our audience know that Ayurveda, 5,000 years of, longevity, 6,000 years, this ancient science has this understanding of how we can approach our being in a way that we can get to that blissful, happy, stress-free individual that's deep in our soul, the Jivatman, the real us. Yet, if we can start to reflect upon, what is it that took us to that ego? What is it that took us to that state, that protective personality being? And what is our program in this life, in our past lives, and our generations that have kind of embodied us who we are now today, that quite frankly we need to break, because that ego being isn't serving any of us, right?
So true. And it's such a big introspective. And some of us might have even forgotten what is beyond the state that I identify myself as, that projection of my ego. Very well said. Thank you so much for bringing to that point.
Thank you.
Further, we will definitely get our audience to know, like, each personality that you were talking about, like a state or an experience, is also a bio makeup, or what Ayurveda says, the Vata, the Pitta, and Kapha. Each one of them have the identity or state somewhat, can be guessed where this is going to go, right?
Oh, absolutely. Isn't that amazing? And just to pause right there, because that is such an important point. You just said such an important point. You can actually predict. And who in medicine can do this, right? If you know someone's state, you can actually predict what things might happen to them in terms of diseases and things and it's somewhat, kind of fortune telling, yet Ayurveda has it templated. And if you look at that and you combine the energetic state with the genetic predispositions and lifestyle, you can start to say, they have Parkinson's disease now, data showing that 20 years before the first symptom of Parkinson's, constipation is the most common, as is anxiety.
Absolutely.
Right? And you think about the Parkinson's physiology, and we talk about this gait and the type of posturing, and very much the Vata imbalance, right? And it's amazing, though, to think that if you can allow yourself to reflect upon, wow, over time, this can evolve, this can happen and worsen. And so we shouldn't ignore the constipation. We should not disrespect the fact that if you're having problems sleeping a few nights a week, don't just take a pill and call it a day. That's what Western medicine kind of wants us to do, is just to keep it simple. Just take something and, and I have a real challenge with that, because I see patients and watch them over the years. What happens when they do that?
Yeah. So prevention becomes the first, role of Ayurvedic approach to these, as we know these patterns when a Vata body type or the wind body type is going through this projection or state and separating from their bodies and minds. We can tell, okay, next step is this, as you said, maybe they'll start holding their stools instead of letting it go, right? And then next step will be, from there, it may be a skin condition, or it may be a joint issue, something like that. We can trace them. Yeah.
And it's amazing how Vata then influences the other, right? Wind blows on the fire, and you start to get then inflammatory reactions. And so migraine, a lot of work I've done in the past is with migraine. And I find it fascinating, because a lot of patients will start with the tension headache, the neck pain, a little bit of digestive constipation, and that's the wind. And then it moves, wind blows on fire, the nerves become excitable and then inflammatory. And they start to get pitta fired up. And we're using all these fancy, they're called CGRP antagonists, medications to block the peptide, that pro-inflammatory peptide that starts in the gut. And yet, quite frankly, if we work on the wind energy, the Vata, and then we kind of reduce the Pitta tendency, we can get a little ahead of this disease, these severe chronic pain conditions, by using these approaches, right? And knowing that one state also can affect another state, right?
True. See, that's the beauty of Ayurveda, Dr. Gokani. We can actually educate people about this so that they become mindful where they are stepping in a place where the mind and body are not working together. The whatever choices that they are making are, being almost disturbing their natural state, and the symptoms will start. Now, I want to go back a little bit and then ask you this question. Now, you said about how the people suffering from neuro conditions such as dementia, etc., they show earlier symptoms in the gut. I want you to explain that for our audience a little more, how the gut, nervous system, and the brain relate to each other. It's fascinating, but I want you to explain that to us.
Yeah, and this to me was so incredible, to start watching how individuals over the course of years presented with gut issues, then secondary leading to neurological issues. When I didn't have all the tools, I would kind of observe these independently. They had irritable bowel syndrome, and then later on started developing dementia or sleep issues, and started seeing these as separate, and then realizing, wait, there's a connection between that. There was a connection between the IBS for 5 years leading to then secondarily these other neurological conditions happening. And then when I started noticing that, oh goodness, we have to start treating this, because we don't want this to be happening. So what we know is this. We know, for example, Alzheimer's disease, which is such a big condition that so many are affected with. The drug companies have kind of given up, on trying to find a drug. They've kind of disbanded this project. You know that, right? How many companies have tried and tried and tried and failed? Because when you look at it, and you really look at it, the Alzheimer's plaque in the brain there is a very important finding in the plaque. It's called LPS, lipopolysaccharide. LPS is actually the outer coating of the gram-negative bacteria that is within the gut. And we all have these bacteria in the gut, okay? And the bacteria live and die and live and die, and they repopulate and replenish themselves. And when the coating of the bacteria kind of dissolves away, the LPS breaks away, usually you clear it out with your morning elimination, and or you have these antibodies. They're called secretory IgA antibodies that grab the LPS, neutralize it, and move it out through the gut. So typically LPS kind of stays within the gut, doesn't affect us. Well, what they found in Alzheimer's is that these little LPS particles were found in the brain and in the beta amyloid plaques. What the heck are they doing up there?
Exactly.
They're not supposed to be up there. So then the theories around this is this idea that, wait a second, Alzheimer's could actually start in the gut. Maybe, someone has an imbalanced gut. They have what we call leaky gut, where the mucosal membrane has dissolved away. That mucosal membrane typically holds, you got it, the mucosa holds the bacteria. The tight junctions keep the kind of the nice gut barrier kind of intact. Well, as you lose diversity of bacteria, the tight junctions get looser and looser. The membrane breaks and boom, things flow into the circulation, move into the system. And where do they go? Up to the brain. This is not supposed to be up in the brain. So these somewhat toxic particles and byproducts that are supposed to be in the gut and evacuated and cleared through our daily movements, bowel movements, unfortunately make their way into circulation. And then the problem with LPS in the bloodstream is to trigger cytokines. It triggers inflammatory peptides. You get a cytokine kind of storm, an inflammatory storm. So with Alzheimer's, we know that. With Parkinson's, they found that alpha-synuclein, which is one of the kind of key findings in Parkinson's, starts actually within the gut. And some say it moves up the vagus nerve into the brain and goes into basal ganglia. Once again, more evidence proving the gut is the origin of the neurological disease. Okay, so if we know that, we've got two important things right there. And let's add multiple sclerosis while we're at it. Fecal transplants. You've probably seen that the data on fecal transplants have helped patients with multiple sclerosis. Why would transplanting a microbiome of another fecal, into the microbiome of a person with MS reduce the symptoms of MS? Because you're repopulating the gut. Bacteria, and the MS symptoms, multiple sclerosis symptoms improve. So there's all of this connection here, and yet we are kind of in the space where we know a lot, yet not a lot is done about this in the Western office. I mean, that's really concerning.
True. It's really, in the recent 10, 15 years, all these research that's coming out with gut biome and then the plaque building, which is from being an Ayurvedic, practitioner, I myself say, how simple was the concept of this undigested material called as ama that gets generated in the gut. And Ayurveda says every disease is because of this material that the body doesn't know how to break down or how to eliminate or excrete. And then it sits and keeps on creating diseases. So,
Exactly. That ama, which is emotional and physical, right? The toxins and the breakdown products of foods that are partially digested, and the ama of those different, we talked about LPS and different toxins that make their way in. And how the emotions, back to the emotions affecting the gut. If I'm thinking a thought, and there is data on this, if you look up the study, if someone is stressed about a surgical procedure and has stress before and after the procedure, you will find that they have a higher amount of Pseudomonas bacteria, which actually makes them more pro-inflammatory and less likely to recover quickly from the surgery. If I'm stressed up here. And it affects, so top down, bottom up, we're having, and that's why in the book I talk about this 3-brain model. And a lot of the book is educational. It's just, let's get this information out there that there's, first of all, Ayurveda, let's understand the Ayurvedic kind of concept of getting into state and how to immune ourselves. I do talk about the ego in the book, talking about the 3-brain, which is how we think, how we feel, enteric nervous system, and then how we digest, the microbiome. And how Ayurveda beautifully already embodies the 3-brain model, right? Ayurveda already talks about the gut and the brain connected together and emotions and thoughts connected to physical.
Absolutely.
So,
Yeah. So these things that are so simplified, in Ayurveda, we say that every meal has to be prepared in terms of improving our ability to metabolize and digest things. So, for example, we say one should eat ginger with salt in the beginning of the meal, and then at the end of the meal, we end with fennel. And things like that, we thought, okay, this is just a ritualistic practices. Because I grew up in India, you grew up in the US in Indian family.
Yeah.
We thought that, okay, the turmeric is only for color in the beginning for us, right? It just
Yeah.
looked really bright, beautiful, and
Beautiful
yellow.
yellows. Yes.
Now I'm so convinced that there is not even a single aspect of Indian or the meal prep that we see in Indian cuisine that every spice has its own role on the gut.
It's amazing. And you might have seen this study when you look at longevity, and this is just a serious thing, that our longevity has gone down. Since the pandemic, it's gone down 2.5 years.
Yes.
This is the first time in history we could potentially outlive our kids in history.
Wow.
With all the advances of medical
medicine, and
offerings
then
care.
trillions and trillions of dollars that we spend on.
Right, 4 trillion,
Yeah.
and going up to 6.28 trillion in 2028. So when you look at this, you start to ask yourself, what are the studies on longevity? And one of the studies that came out recently was saying that if you can allow yourself to have 30 plant species per week, your longevity will increase. And whenever I say that to somebody, they say 30 plant species. Oh my goodness. Like, I'm lucky if I get broccoli in daily, right? So when you think of plant species, it involves the spices too.
Exactly.
And Ayurveda already knew this.
Yeah.
Diversify, add spices, throw the cumin and coriander and fennel, and throw all these spices, because then the gut microbiome diversifies. And there's a lot of housekeeping function down there. And if you don't have the different individuals doing the work, the different keystone bacteria, doing their job of breaking down carbohydrates, breaking down proteins, doing all the important neurotransmitter production. Every neurotransmitter is made in the gut.
Yeah.
Oh goodness. Good luck.
Very much so.
Okay,
Yeah.
right?
Yeah. And then the going back to the concept of that state, when most of our people who suffer from stress induced, whatever health condition, I would say in many cases, it's the mind that takes the upper role and then becomes almost an abuser. And then the body becomes the victim.
That's a nice way of thinking about
So
it.
the state becomes such toxic that the body will now start showing skin reactions, hives, and constant allergies, and finally autoimmune conditions where it's saying enough is enough, So Ayurveda, what it does is it takes that spices to make the body vibrant so that the mind starts loving the body. So this is what, when we talk about making the diet in Ayurveda rich with 6 tastes, rich with different colors and textures, eating with 5 sense organs in a given meal is, I think, to bring the mind closer and closer to the body so that they glue together. And then there is no these room for ego to create those states.
I love that. That's such a beautiful, beautiful way of expressing that. And it's amazing because it is so true how our mind can work for us or against us. And for very many, 80% of the thoughts are negative and 95% of our repetitive thoughts. When you look at the data on this, and one gets stuck in that pattern, and it's challenging to break it. And I encourage patients, I've trained in transcendental meditation. Let's do some TM together. They say, I can't sit still for even 10 seconds. My mind starts to go into the wondering and worrying and the what if thing. And so what do? I love what you just said, starting with some basic dietary shifts, adding the ginger beforehand, having a little fennel afterwards, engaging the senses, smelling your food. 35% of your digestion is cephalic. It's happening up here. How does your plate look? Does it look pretty? Does it look lovely? Are you taking a moment just looking at how gorgeous the food is on the meal before you eat the food? And now you're chewing our food, right? There's so many things within that. Taking the time to taste.
Yeah. And then having said all of this, everybody who's listening will be saying, yeah. But when given a chance, we just stuff stuff into our mouth without even. So since we are into this depth of concepts in Ayurveda about the mind, Dr. Gokani, I want to talk about something called as prajnaparada. So in Ayurveda, there is this word which is seemed to be the cause for every disease. right? So you might have contemplated being a neurologist, you would have thought about how do I put this in terms of disease manifestation and how the person's choices are. You touched base a little bit in earlier conversation that we were having. I just want to get into that and tell our audience what Prajnaparada is. And then I'm sure in your book, you would have definitely touched upon that.
Yeah.
Let me listen to you on that.
So first book really did focus much more on those concepts. I definitely touched on it in second book, but I wrote my first book, Mysterious Mind, back in 2015 and went over some of these core principles. And that to me was one of the most profound ones when I learned Ayurvedic medicine back, a couple, 2-3 decades ago. And the idea of the mistake of the intellect, the idea of living in a way where you're making choices, be it food choices, relationship choices, career choices, out of a state of disconnect, right? Mistake of that intellect. And to me, I kind of tie it back to what we were saying earlier, the ego pulling us and the state imbalance. And when you're in that other personality or being, it's challenging to make the best decisions, isn't it? You're not
absolutely
making decisions from your best self, are you?
Yep.
Right? What do you think? What do you think?
True.
Yeah.
So the aspect that we have to bring in and encourage is that intellect aspect. The intellect is something that almost slightly pulls away our those patterns and ego to see the space between the mind and the body becomes lesser, where the power of reasoning is telling to us this choice is not the right choice. And there is only a tiny time frame that we have within which we have to identify. Otherwise it'll flash like that and then we fall back into the same pattern.
Exactly. So it's that discrimination, right? It's that little teeny discrimination sense that just kind of allows you, and that's where becoming an observer is really important.
Exactly.
And being able to negotiate that I'm now moving into that personality versus my authentic, and the decision is being made from the personality, not from me. And that is one of the most challenging things to do in life, isn't it? Is to find a way to make choices that are truly resonating with our true blissful self, because quite frankly, we've got bills to pay. We've got kids to take care of. We've got situations in life where sometimes things aren't clear. We don't know. This person seems like a nice person to work with. Let me try working with this individual. And you don't know, sometimes you kind of hope and have faith and you start and you say, maybe not. Maybe my intellect wasn't quite perceptive. And maybe there's a part of my personality that chose this because it wanted something else. And I didn't quite see clearly. And, all I say is we give ourselves compassion and love and know that if we can try, like you were saying, to just meet that moment of discrimination, within the koshas, right? Vijnanamaya kosha, kind of like that just subtle, sense of, wait, this is actually a better choice for you because, and it's speaking from the highest truth.
Yeah.
Isn't that?
Yeah. When you said it so beautifully, it's so subtle, but when you make a choice, it becomes so powerful, right? So that's where the power of meditation comes in to enforce how to identify that moment when our mind is now able to use the intellect and discriminate and make the choice.
And that's so beautiful. And that's to me, even the movement practice of very gentle restorative hatha yoga and practicing opening up the physical body, getting into a quiet space with your own physique and your own emotions. And then that shavasana, which is the most important pose in yoga, right? Because the idea is that it's in that time. I remember, I teach yoga, and whenever people make it to that space, that time of shavasana, they come out and they're like, wow. They can look at their life differently. They can reflect upon everything differently in just a few minutes, right? Because that's what you're tapping into. There are times there was actually an interesting story. Yeah, go ahead.
Yeah, throughout the day, there are these multiple, small windows that we are given. And Ayurveda beautifully says, if you fix a routine to it, and there is every moment that can come up in your mind and in your intellect upraised, and then it comes right showing to you there is the choice for you to make. And that's the wisdom of Ayurveda. It says here is something that you cannot miss, and it will make it so obvious if you have it in a routine.
And we can look at the other way too, is if you're And we've all at some level been there because we're human and we're living a human experience and none of us are enlightened quite yet, right? So we've got work to do. So sometimes we're going down a path that doesn't feel right and there's challenges and there's obstacles. And so for anyone listening that's saying, wait, how come I'm not getting these intuitions or these intellectual
Messages.
kind of awareness and messages, right? How come I'm not getting that knowing being sent to me? That's okay too, because sometimes it's in the journey of not knowing, following a path that isn't the right path, that you find the right path for yourself. And so if you're someone that's moving in a direction that doesn't feel quite harmonious and feels challenging and there's obstacles, then pause and ask yourself, what is it that pulled you into that direction? And then what can you do to navigate yourself back to your intellect, right? Because I do meet a lot of patients and people that say, I don't know, life has kind of handed me so many difficulties and different challenges.
Yep.
And back to what we were saying earlier about why these symptoms happening for you, why these challenges happening for you. What can we do to then reflect upon that and shift course into the right direction, right?
Perfect. Yes. Yeah. So true. So true. One thing that we want to tell all our listeners to have as a routine that they can use on a daily basis.
Yes.
To say, okay, these maybe 1-2 steps that they can take towards achieving, managing a stress strategy or something like that. I want to listen to you on that.
Yeah, I mean, my favorite two from, I'll say book 1, then I'll get to book 2. From book 1, my favorite 2 that I just was really encouraging, if we can accomplish these 2 things, so much will happen. Number 1, the importance of sleep. All of this began with my sleep challenges in medical school. Ayurveda found me to help me. Getting to bed at 10 o'clock. It's such an important thing to try as best as one can, as many days per week, to try to get to bed around 10 and to sleep as much as they can to restore themselves. And yes, there's this magic window of getting up at 6 or 7 a.m., yet I meet a lot of people that have adrenal fatigue and they have very, very imbalanced thyroid and may need to sleep a little bit more simply because of their condition. Though I'll say the 10 p.m. bedtime, if one can do that, right? Because the liver, 10 to 2 is when the liver is cleansing and detoxifying. It does magical things to your mind the next morning. And then lunch is your biggest meal. Those are my 2 favorites because back to pitta, fire energy is during that 10 to 2 window. Eat your food. 2, it's really a different kind of approach going into what is it that's keeping you in state. So in book 2, I get a little bit more into understanding what is it that is maybe come into our lives that's created trauma. What has let us allow ourselves to get stuck? You mentioned negative thinking patterns. What are the programs that's keeping us in a state where we're not able to move past and improve our health or succeed in life? And it's a little bit more reflective. And one simple thing to do is just to sit every morning and reflect on what patterns have been working for you and what's not working for you. And think about your areas of life: career, relationships, family, spiritual growth, personal growth, health. What area of life is most challenging for you? Just to start really basic. And then what are the patterns that you're noticing, that you're doing, that are keeping you stuck? Because there's usually something there that you can break. And that you might need a coach to do it. Though if you can start thinking about it, you can start to make some of that shift and start observing,
Yeah, beautiful. This I also somewhat, when people have emotional eating habits.
Yes.
I tell them, you're identifying yourself with the food, not as a consumer, and then I tell them, take just a moment to look over your shoulders when you're about to eat. Who's following you? Who is on your back? Is it your anger, or is it your greed, or is it your sadness? Who is on your back?
What's there? Yeah.
And if you think that they're on your back, just say thank you. Wait here. I'll come back. We'll resolve this. But let me have this beautiful moment of creating myself by eating mindfully what I'm eating.
Exactly.
So, what is your first book, Dr. Gokani? If you want to tell and share to all our listeners here.
Yeah. The first one was called The Mysterious Mind, and that was written in 2015, 10-year anniversary. I can't believe. And that was really, the focus was teaching those that struggled with pain, because the focus is a little bit more on headaches. Many individuals can benefit from that one. That was really looking at how does Ayurveda play a role in Western medicine, and how can you use some tools within your doctor's office. So for example, I talk about the gut brain. Before, people were doing food intolerance testing and knew that gluten was potentially a possible problem. And I talk about the studies in my clinic where I was doing food intolerance testing and finding most patients had a dairy intolerance and a gluten intolerance. And then adrenal fatigue is a big conversation. And how do we imbalance our own adrenal system? Those two little adrenal glands sit above the kidneys making cortisol. Unfortunately, they make too much cortisol for too many. And I found that 90% of my patients had adrenal fatigue. So I kind of discussed that because I look at a lot of the Ayurvedic herbals, and a lot of them are adaptogenic herbals that support the adrenal system.
Yeah.
And we know that if your adrenals are stressed, the mind is stressed, the gut becomes dysbiotic. We start to carry pathogens in the gut.
Yes, that cycle
so this
again.
Mind, back to the mind and gut, right? And so book one kind of touches on like dosha types and what's about the dosha. And then book two is like, okay, you know a little about doshas? Let's move into why you get stuck in the doshic state.
Yep.
So why do you get stuck there? And then go into trauma and the ego and attachments. And, it's just a fascinating thing for me to keep on learning from patients and from coaching clients, because book one got them so far, and then book two gets you further. And it's one of these things that if we can learn the material and then find the village of people that can help us, because the books, I will say, are not standalone. Okay. They're great resources to understand all these complex topics that we're talking about. Yet I do feel working with your primary care doctor, an integrative practitioner, maybe an Ayurvedic practitioner, if you can find, to help you move things forward by understanding what you need to work on, you can move a lot faster. I found a lot of my patients in the past would go see providers, not quite understand why they were being given this bag full of supplements, to be frank with you, or why they were taken off it. And they didn't get the big picture. So it's trying to put it into a way that now you have a kind of a manual to take, and you can start improving with the work, yet you can get even better if you go further. But everyone can start wherever they're comfortable, right? So that's the idea.
Yeah, everybody's experience is different.
Everyone's experience is different. And I think because I'm board certified in neurology, people tend to listen, Sorry to interrupt, but I'm saying because I'm board certified in neurology, I tend to get people to listen a little bit more and say, come on over here and look. And not that, I think that the neurology has helped me as much as the Ayurveda has. It's just, it opens the door for those that are looking at more of a Western approach to move over to the Eastern side of things and to realize we're all trying to improve ourselves and use these tools optimally. And you can use them both together. You do not need to go one direction or the other. Sorry, just wanted to say that because it's so important,
Yes, it is true. And you said it correctly. Ayurveda is the manual for, healthy longevity and 100 years of living.
Yeah.
And I think this was a wonderful conversation, Dr. Gokani.
Thank you.
I think our audience will be saying, yes, there's some, truth to Western science, and then there's also a depth in Ayurvedic science. So how do we bridge them together and then take best out of both? And there is your book, which talks about these aspects. Thank you so much for joining us.
Thank you for having me. Such a pleasure speaking with you.
Thank you. And namaste.
Take care. Namaste.